My name is Sydney Hurst, and I will be talking to you today about borderline personality disorder. You're probably wondering, what is borderline personality disorder? According to the Diagnostic and Statistical Manual of Mental Disorders, DSM, defines borderline personality disorder as a pervasive pattern of instability of interpersonal relationships, self-image and affects, as well as impulsivity, beginning by early adulthood and present in a variety of contexts. Psychologists and psychiatrists use this manual to define someone with a mental illness. Borderline personality disorder is a mental illness. Some of the signs that are portrayed in this visual aid are only some of the signs that can be portrayed in a person who has borderline. Disturbed identity. It can be a disturbance of their self-image, they're unstable, they have chronic feelings of emptiness. A big one of disturbed identity is abandonment. People will hold on to a relationship, doesn't matter who it is, mom, dad, partner, that they will hold on to that in any effort they can. Disturbed mood. It's emotional instability, anxiety, and usually that's only lasts for a few hours to rarely a few days. It's different from bipolar because it lasts a shorter period of time. They're unstable with relationships. They will idolize someone, and then that person will tell them something, and they will devalue that person to like they are nobody. They put people on pedestals. They also have intense anger or fighting, lack of control that overwhelms them. They have a high intensity of feelings. Disturbed perception, having feelings of persecution, dissociative symptoms. Sometimes they're off in their own world, not thinking of what really in reality. They're thinking of other thoughts. Disturbed behavior is impulsive things like harming themselves, suicide attempts, reckless spending, reckless driving, a lot of partners for sex. Sometimes it can also include suicide. Some people have actually committed suicide with that. Sometimes a lot of the suicide behaviors of threatening will go back into, trapping somebody in the abandonment. You're probably wondering how many people in the general population have borderline personality. In this graph here, it shows the blue is general population. The little slice of red of 2% is people who have borderline personality disorder. If you think about it, 2% can be quite a bit overall the general population. What you might want to ask yourself, is it more prominent in men or women? As we see here, the red says for women, and that's 75%. The blue is for men, which is 25%. So it's more prominent in women, as you can see here. There are different therapies that help people with borderline personality disorder. They cannot be diagnosed until they're 18 years of age or older. Therapies, there's two different types of therapies that include for their treatment, and that would be cognitive behavioral therapy, and that's a form of psychotherapy that helps people to think clearly, to the way they act, to different obstacles in their life, what we feel about things. Another form of therapy is dialectical behavioral therapy. And dialectical behavioral therapy, DBT, goes into 4 modules. And that is, one is mindfulness, that you want to be present in the moment. You don't want to have the dissociative thoughts. Another one is distress tolerance. People with borderline, they usually have a high intensity of emotions. So this helps them recognize their negative situations, and what to do in a stressful event. Also, emotional regulation. They will teach them how to label their emotions instead of just blowing up. They can say, I feel hurt because. That helps them. And interpersonal effectiveness. It teaches them to change something, to change the way they're thinking, to change the way what is going on. How can they help change it? Also, support groups are another treatment, and medications. Medications are usually used when people show suicide attempts, so they will be handed antipsychotics because of that, or mood stabilizers, or they can be anti-anxieties or depression. When you combine a few of these, especially one of the two top therapies, with support groups and medication, they all work together. You maybe go to therapy once a week, and then group maybe twice a week, and then take your meds regularly, and that overall helps. As you get older into your about 40s, it starts to dissipate. In conclusion, borderline seems to be getting more common. We need to let professionals know, police officers, therapists, anyone who deals in the social service field, know these symptoms and signs so they can help each individual and guide them in the right direction where they need to go.